My wife and
Well, I
kids.
don't feel any difference.
And the new Rolex is just
Yeah.
like this.
The
A little heavier, a little
only thing I got,
more gold,
the only thing I
more
had
heavier,
today is
but basically the same size.
and let the Coast Guard know where Sander was all.
I've never asked, how many kids do you have?
Two.
Remember what you did?
Seven. It was $7,000. Yeah.
It's just coming.
CJ.
Yeah, that was priced the same as this one here at the Yellow Sander.
And
Don't worry about it.
Olivia.
Yeah.
I thought about getting that, but this, I wanted this one.
For a dress watch.
Kindergarten class when that school was new.
Oh, really?
I went to school with Governor Milliken's son and Johnny Whipple over that owns Whipple Park.
Oh, really?
Oh, we had
What school is that?
Eastern Elementary.
See, I was in the last graduating class for the high school groups before they moved over
Before they
there.
moved?
Yeah,
Yeah, and then it became a junior high.
yeah.
So, but at that time it was grade school, junior and senior high when I went to school there.
Wow.
300 graduating.
It is a huge building.
Oh, it is.
Okay,
The third floor is all shut down because of asbestos.
Yeah.
yes, and I went into the
eventually had
third floor.
Cupcake at
That's where the study hall was.
Yeah, so do I.
Glucose?
All right, I would like to call the Wednesday, October 2nd,
Blood test tomorrow.
Public Health and Safety meeting to order. If we could all rise, please, for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Sarah, roll call, please.
Rennie,
How many times I said that?
Rennie,
Here.
Inman,
Here.
Thomas,
Yep.
Wheelock,
Yes, ma'am.
Lemkool,
Here.
Lathrop,
Here.
Maxbauer.
Here. At this time, I would entertain a motion for approval of the minutes.
Madam Chairman, I'll make a motion to approve the June 5th, or excuse me, the,
June 5th.
no, I'm sorry.
That's right.
They've got it typed in as June 5th, I
It
don't know why.
It's supposed to be.
It would be the September,
No?
No,
it's June
it's
5th.
June 5th.
oh, we didn't have one.
That's right.
So June 5th is correct.
It is, yes.
Oh my gosh, how time has flown.
Where were you?
I will make a motion to approve the June 5th, 2013 regular committee minutes.
Support.
All right. Moved by Commissioner
decade,
Inman,
right?
seconded by Commissioner Rennie to approve the June 5th, 2013 Public Health and Safety minutes. Discussion. All those in favor say aye. Aye. Opposed, same. Motion carries. This is our first opportunity for public comment. Sarah, if you would please read the rules for public comment.
Any person shall be permitted to address a meeting of the Board of Commissioners which is required to be open to the public under the provision of the Michigan Open Meetings Act. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board shall state his or her name and address. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioner questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chairperson may, at his or her discretion, extend the amount of time any person is allowed to speak. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4 Order of Business. However, public comment will generally be received at any time during the meeting regarding a specific topic currently under discussion by the board. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized and shall not address the board until called upon by the chairperson.
All right. Would anyone like to come forward with public comment? Georgia?
Good evening, Georgia Durga, Director, Grand Traverse County Commission on Aging. I wanted to say that today I was fortunate enough to hear Commissioner Inman's presentation on Amelia Earhart at the Traverse City Senior Center, and it was fabulous. He had a big crowd. He's done presentations at the other 4 outlying senior centers, and all of them have been really well received, and he had many questions. So it was an excellent presentation. I encourage any of you to go see it if you have a chance, because it was wonderful. And I wanted to thank him for coming to the senior centers to do the presentation.
All right, you're welcome.
Good job.
Thank you, Georgia. Anyone else? Karen?
Good evening, I'm Karen Rennie, and I'm the wife of Commissioner Charlie Rennie, but what I prefer to say is that Charlie happens to be my husband. I am involved now with an organization that's been spearheaded by the Secretary of State, Ruth Johnson, and it is called the Gift of Life Program, and she has become pivotal in organizing this, of which I'm a volunteer, and I was at the Secretary of State's office today, and we enrolled several people, which was very heartwarming to me, being a registered nurse. This never really resonated with me, the need for this, until it hit home in my own family with my daughter-in-law, who is a 30-year-old patient in kidney failure and awaiting a kidney transplant. She has a home dialysis 5 days a week, so it's a terrible situation, and it occurs with so many people. So this is my little way of getting out and trying to encourage anybody who goes into the Secretary of State, or you can go online and donate issue your intent to be a donor for your organs, tissue, cornea, any number of things that I was really unaware of, and one person can save or enhance up to 50 lives. So I left you all a brochure. I left you a little bookmark that's got a great poem on the back, which I thought was very heartwarming. Additionally, we have a new plate that's out, and I'm going to be getting one of these plates to have on my car. It's $35. However, $25 of your $35 plate goes toward this organization. And I just wanted to read you this one little mission statement. It said, "The mission statement is to improve and extend the lives of the citizens of the state of Michigan by increasing public and professional participation in organ and tissue donation for transplantation." Thank you very much.
Thank you.
Thank you, Karen.
Karen, I've already donated.
Thank you, Dick.
All right, anyone else? Seeing no other public comment, it is time to approve the agenda. I do have one addition, and it will go under new business, the Senior Companion Award for 2013. Please note that a description of it is on your desk, and I will speak to it when we get to under new business. I also need to remove, under special orders of business, Storm Ready Certification Award. And Dave, is there a closed session tonight?
Yes.
Okay, we will have a closed session. And any other additions to the agenda? Commissioner or Dr. Lathrop?
Yeah, I'd like to add a short discussion on budget processing.
Okay. We will put that as number 2 under new business.
We also got an email for talking about NIMSAS as to a discussion as to whether or not we should want them to come in and make a presentation. I just got an email today for that. And I didn't know if you, I mean, with you being on the mental health board, maybe you might want to bring that discussion in here and have that at one of our meetings to talk about where they're going with the managed care.
Commissioner Rennie?
I believe Chris Kramer put a memo out on that.
Yeah, she did.
And asked for a response back to see if we would be interested in having a rep here.
Well, that's why I'm asking if we would be interested in that. Maybe we can put it on our agenda for next month.
I'd be interested in that.
Okay.
I would be too.
Next week.
All right.
I don't know.
With those changes to the agenda, I would entertain a motion to approve.
Support, motion to approve.
Motion by Commissioner Lemkool, support by Commissioner Thomas. Discussion? All those in favor say aye. Aye. Opposed, same. Motion carries. Next item on the agenda is consent calendar. Sarah?
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted received in file or approval is approved by a single committee action adopting the consent calendar. Receive and file. 1. Community Corrections Report, August. 2. Commission on Aging Report, October 2nd, 2013. B. Approval. Fiscal year 2013-2014 Michigan Department of Community Health Comprehensive Planning, Budgeting, and Contracting Agreement.
All right. Does any member of the public wish to have anything removed from the consent calendar? Seeing none, any commissioners? Staff? I would entertain a motion for approval.
Madam Chairman, I'd move to approve the consent calendar as provided.
Moved by Commissioner Wheelock, supported by Commissioner Rennie, to approve the consent calendar. Discussion? All those in favor say aye.
Need a roll call.
I'm sorry, roll call. Thank you.
Inman,
Yes.
Thomas,
Yep.
Wheelock,
Yes, ma'am.
Lemkool,
Yes.
Lathrop,
Yes.
Rennie,
Yes.
Max Bauer.
Yes. Brings us to special orders of business, and that item was removed. There are no items removed from the consent calendar, which brings us to department action items. The first action item is the Health Department 2013 accreditation. Wendy and Mr. Miller. Please introduce yourselves.
Wendy Truitt, Health Officer, Grand Traverse County Health Department.
And I am Mark Miller, Director of Local Health Services for the Michigan Department of Community Health. Go? Okay. I bring tidings from our boss of the Michigan Department of Community Health, Jim Haveman. You might have heard his name lately because he was responsible for getting the recent Medicaid expansion through. And also our Director of Public Health, our State Health Officer, who is Milani Brim. So good evening, and thanks for the opportunity to appear before Commission Chair Herb Lemkool, and then also Public Health and Safety Chair Christine Maxbauer, correct? Thank you. And then the rest of the Board of Commissioners. And I'm here to present a certificate of actually 2 certificates of accreditation to the staff at the Health Department and the Commissioners, and then also Health Officer Wendy Truitt. The accreditation certificate represents a high level of achievement and requires close collaboration on part of everyone to achieve the high quality of public health services that are the hallmark of the Grand Traverse County Health Department, and recognizes the important role public health plays in the lives of Grand Traverse County citizens. So what is accreditation? Accreditation of local public health in Michigan was the first program of its type in the nation. The process was developed jointly by representatives from then Michigan Department of Public Health and representatives from local health departments. Public health standards were developed in 12 program areas and have been modified and improved since then. And these standards, if met, ensure that programs and personnel are in place to provide in an efficient and capable manner a number of critical healthcare services. So the process we had last August in 12, it's an intense 1-week activity at the health department, and I know the poor staff at the health departments lose a lot of sleep over it, both before, during, and after. We reviewed 12 program areas with stellar results. Of the 153 applicable indicators that were reviewed and evaluated, the health department met all but one. So 99+% just during the week we were here, and the other one was rapidly taken care of. Also, Grand Traverse completed the Quality Improvement Supplement, and only about half of our health departments can do this. And again, that means you get 2 different certificates. Many of the standards are difficult to meet, but a very committed and talented health department team were up to the task. The achievement means that the health department is very progressive, constantly looking for areas to improve, providing efficient and better services to the residents of Grand Traverse County, and being a state leader in demonstrating best practices for the rest of the state. This level of performance is not accidental. This is the 5th time that collectively everybody here has been accredited. It requires time, energy, resources, and talent. There's obviously a very positive working relationship between the county administrator, the commissioners, and the health department. And the health department has a ton of close collaborative relationships within the county and also across the state. Maintaining funding for services and positions in the health department are paramount, and we encourage you to continue your support for the department. Most positions are supported by some combination of fees, local resources, state funding, and federal funding, and we appreciate your support. And what I've got now is the kind of the meat of the presentation. These are actual comments from the reviewers of the different programs. And the area that I review is called Powers and Duties, and it looks administratively across the health department. Mr. Thorell did an outstanding job preparing for the on-site review. That's Dan Thorell, he's back here. All materials and documentation were well organized with specific items listed by indicator. And I know Diana Anderson and Debbie Miner also helped a great deal on the organization of the overall accreditation. The Health Department's annual report makes ample use of cost-effective analysis, proving to county residents that services are delivered in the most efficient manner possible. I'd say maybe 10% of all our 45 health departments actually do some cost analysis, so you get a lot of kudos for that. The Community Outreach Coordinator described activities using social networking. The Health Department has one of the most extensive and effective programs for social networking in the state. The reviewer was able to visit both adolescent clinics, and I know Amy Leva and then also nurse practitioners Kim Michaels and Alicia Clausen's working there, and then also public health technicians Carolyn Christoph and Shameen Harrison. They all run a very effective operation. The director of our adolescent clinics in Lansing, Carrie Terry, often crows about the excellence of the adolescent clinics you've got up here in Grand Traverse County. In food service, the department is congratulated on its excellent records management and the following excellent ratings. These are all 90 to 100%. Pre-opening evaluations, evaluation frequency, temporary food and evaluations, enforcement policy, consumer complaints, and a bunch more. So Tom Buss and his bunch do a great job on the food program. In immunization, the health department routinely provides recommended vaccine for all ages. And they bill private insurer carriers in the community, which means they're trying to get back revenue that they're entitled to get. A lot of our health departments really struggle on billing issues, but Grand Traverse is a leader in that regard, so kudos to the accounting folks and the billing folks at the health department. The health department does an aggressive recall for children and adolescents for the entire jurisdiction and does a report on that. In communicable disease, and I think Martha Thorell is here, you work in that, communicable disease. The Grand Traverse Health Department receives special recognition for the creation of a biannual quarterly newsletter. It provides CD information and other topics of interest for area providers. And then also a number of communicable disease presentations are done in a number of venues, such as conferences to the county commissioners and community health education fairs. On-site sewage treatment management, that's another one of Tom's programs, isn't it? This indicator for site condition documentation was met with 100% compliance. The review found excellent documentation of site conditions as part of the site evaluation. The septic guys we have out of DEQ are really tough raters, so these are really exceptional ratings for the sewage treatment management program. Also for permits, the indicator was met with 100% compliance. Drawings were clearly identified by the sanitarian as part of permits, and specifications and restrictions are clearly identified on the permit. So kudos to the EH program. In STD and HIV, Bob Berry, who did the review, wrote 7 special recognitions. He usually only writes 2 or 3. And rated exceptional were that the review was well organized. There's a highly detailed and comprehensive client screening tool. They prioritize higher risk patients. They hire and utilize bilingual staff, and they have expanded clinic hours. So great STD HIV program. In family planning, it's kind of remarkable. Family planning, they have about 23 indicators, and their report is the longest one we have. It's 14 pages long. And they have, some of the indicators have 30 items you have to produce in order to meet it. And you didn't miss any of the indicators, which is phenomenal. And they said that the Health Department has excellent administrative policies reflecting Title 10 regulations and the agency's mission. And the Grand Traverse County Health Department works very well with the adolescent clinics in the county. One of the small programs, I don't know if any of you heard, you have a hearing and vision program where they do screening for hearing and vision issues for kids early on in life, and they may find out they need a pair of glasses or a hearing aid, and it may keep them out of special ed or something like that. So it's a small program, but it's important. And the reviewer said the written policies and procedures for screening preschool children are well written and thorough. The first sentence indicates that 3 to 5-year-olds are a priority. This is so satisfying to see in writing. Nice work, ladies. That's our reviewer's comment. Is that, whose program is that? Amy's?
It's under Jody now.
Oh, is it? Under Jody? Okay. All right. These programs are provided with information regarding clinic appointments that are available at the Grand Traverse County Health Department. The hearing and vision technicians work very well together to provide these services to the county. Vicki Klingel-Smith is relatively new, but has provided extensive improvements in record keeping. She's an outstanding worker and a role model for public health servants across the state. The health department is indeed fortunate to have Vicki's talents and background. Also, Pat Behrens, who has been with the program for 25 years, and Sue Cork round out a team with great experience and commitment to the programs and the children they serve. And then this comment, this is the most organized and comprehensive accreditation on-site review that this reviewer has ever experienced. Special recognition goes to Vicki and her staff for their expertise in facilitating such a great review experience. Excellent work. This comes from Dr. Rachel Schumann, who hardly ever writes anything nice about anything. And I would have to go back and ask her if she had a drink before she went to this. But no, you have a Cracker Jack program here. And this is really high praise from this reviewer. In Children's Special Health Care Service, that program just came into accreditation last year, and some of the folks in the first year, it was a struggle because some of our reviewers weren't rating things right. And you guys didn't miss any of them, though, which is incredible because every other health department has missed 1 or 2, and you guys had 0, so that's great. And I think that's under, is that under Jody Kelly and Jamie Beck? Okay. The health department is exploring the use of text messages and emails to communicate with families and using expanded communication capabilities to reach the identified population. The staff has done a wonderful job updating plans of care. They do them regularly rather than just annually, and they demonstrate excellent teamwork. The WIC program, besides providing nutritional services to about 2,500 pregnant women, children under 5, and infants, the program partners with area food vendors to the tune of $1.25 million. The WIC staff do an excellent job ensuring clients are seen within the time frames required. So all in all, the programs and all the reviewer comments were all great. We have 45 excellent health departments in the state. Some are more excellent than others. And I got to tell you, sometimes I struggle to pull out enough good stuff so I can do a presentation to the Board of Commissioners. My problem here was to cut it down. So, which is a nice situation to be in. At any rate, as you can see, the health department is performing admirably across a range of programs. I encourage you to continue this excellent public health work for Grand Traverse and Michigan residents. The health department here creates a standard that many of our health departments should emulate. I'd also like to recognize Jerry Pugh, who served nobly as the interim health officer, and he worked very hard on to put together the accreditation last year. And I want to salute everybody on the Board of Commissioners who support the health department with your time and efforts. I compliment you on the construction of a facility that has to be the finest public health facility in this state. I compliment you on whoever got to construct it and whoever organized it. It's just a wonderful facility. And then also, you guys were able to recruit Wendy. And Wendy is our only certified well, certified something else, but our only she's a true epidemiologist in the state. We don't have another health department or health officer that has those credentials. So you guys were really did a nice job recruiting her from Illinois. It was their loss, that's for sure. And I want to salute all the rest of the staff who provide all the direct service to clients. Your health department is a very impressive organization with great leadership programs and commitment to services. The citizens of Grand Traverse are well served by this agency. We appreciate your continued collaboration, are very impressed with the efficient and innovative programs being delivered to the residents of Grand Traverse County. So congratulations.
So I just wanted to add a few things. I can take no credit for this because this was prior to my arrival here. But a lot of the staff are here tonight who were very instrumental in that. And it's the hard work of everyone at the health department, day in and day out, that is recognized during the accreditation process because it demonstrates the quality of the work that they do every day. So I did want to, some of them kind of waved, but I do want to make sure you know who they are. Tom Buss is the Director of Environmental Health. Martha Thorell is the Director of Disease Control and Prevention Services. Jody Kelly is our new Director of Maternal and Child Health Services. She replaced Kit Mikovits, who retired recently. Lori Wesolowski, she's a supervisor of the WIC and Maternal and Infant Health Program. Amy Leva is the Adolescent Health Clinic Supervisor. Debbie Miner is the Administrative Assistant for Administrative Services. Dan Thorell is one of our environmental health sanitarians. Jamie Beck is one of our public health nurses. Diana Anderson is an administrative assistant in the community health program. And he did mention, not present tonight, but people who were very instrumental were, of course, Jerry Pugh as the interim health officer and as director of finance, Kit Mikovits is the former director of maternal child health, and then Dr. Collins, our medical director. So I just wanted them to be recognized. I'm proud to serve next to them every day. So
Great.
Well, Wendy, I just have to say that you and your team are a group of leaders, and I can't think of anything better to say about employees. Thank you all.
thank you.
You owe us $5 for the frames. So. You heard the federal government's close. No, we'll pitch in for the frames.
Somebody want to take a photograph or a picture
I do not have a
of those,
camera, believe it or
of
not.
those two? And
Dave said he's got one.
All right.
something?
So
With the
what I'd
staff-
like
let's
to
get the
see-
staff in it.
Staff
and,
up.
I'd like the
Let's get them all
staff come
stand.
up here to be
Sure,
part
let's
of
get the
this
staff and,
presentation. I think it's really
you-
important to recognize the staff.
I can take a picture.
And to heck with the commissioners being in the photo, just let the staff come
That's a
up.
bigger camera.
You guys up here.
Come on.
That's a better camera than this.
I wouldn't even know how to do
They're
that.
gonna come in front of us. or-
Okay, Commissioner,
I
stand
mean,
up.
we didn't do this.
Yeah.
Yeah, we do.
Scooch in, guys.
Come on over. Come on in here.
It'd be nice to Charlie.
Have you seen?
He's towering over us.
Hold me up. Yeah, why?
If he wasn't standing on that chair, he wouldn't be so damn tall.
See if I can get a flash on. Auto flash doesn't seem to.
An iPad, that would take a good picture.
There we go.
Do you want to be in there?
Yeah, Dave, come on, get in here.
Oh, we can see eye to eye, Charlie. Yeah, let's get Dave in here. Squeeze him in somehow.
I'll scooch over.
There you go.
There we go.
Everybody on their toes.
And count of 3. 1, 2, 3. I'll go in a couple.
Great.
Good job.
All right.
Congratulations.
Nice
Thank
job.
you.
Good job,
Appreciate it.
guys.
Thank you. Yes.
We brought you some treats. We gave
Thank
them
you.
staff
Yeah, and they brought us
a
cupcakes.
little
We
thank you
we should have furnished them with cupcakes.
That's right. Yeah. Well, hopefully we'll get some apples out.
We know.
That must be next door. I saw her come in.
She's here.
All right.
Thank you very much.
Next on the agenda is the prosecuting attorney's 2014 Crime Victim Rights Funding Grant. and the prosecutor is requesting immediate approval. I would entertain a motion for immediate approval. Moved by Commissioner Thomas, supported by Commissioner Rennie. Discussion. All those in favor say aye. Aye. Opposed, same. Motion carries.
I think it's important to note that's doing some great things for our community. The people in the Victim Rights Program, they really help the whole process. And I don't think we should just let this go without some sort of comment. And I'm sure, Chris, in your office, you recognize the talents of the people you got there.
Yeah, Denise Smuckle and our other staff, they do an excellent job working with our victims, making sure our victims are part of the process and are present through every stage of the criminal proceedings.
And I do apologize, I should have mentioned that this is for approval of accepting a grant that funds that program that is so important to victims of crime. And I've been a victim of crime, and I have to tell you, it's a wonderful program. Next on the agenda, administration, letter of approval for administrator controller to sign IT agreements to be distributed.
Okay, IT meaning implementation team. There should be
a memo.
I thought that was already passed out, but
I
apparently
don't have one.
I have a pile of papers here.
A technical error.
That's what happens when they delegate things to me.
Yes,
Dennis had the same problem.
This evolved as things have evolved. Chris and I have been working with the implementation team many hours out of every week to try and get this project moving. As you know, we are right now engaged in, the city and the IT are engaged in litigation with the Brown Bridge, people that live downstream from the Brown Bridge. And the county is involved in litigation with some residents on the Boardman Pond, former Boardman Pond. Well, actually, it's still a pond, but it's quite a ways away from their back door now. At any rate, in this process, and due to the Brown Bridge incident, it's become difficult to get things done. Chris might want to elaborate a little bit on this, but the attorneys for the Attorney General's office and the attorneys for the Department of Justice have been advising their members of the IT to, well, not get in the way of things, but not actually get too involved in it. They're kind of worried about the whole, their role in the litigation process.
Right.
And the fact remains that we have a contract with the designer of and the engineer of the next phase of the project. The IT has gone through quite a process to select the vendor, and they're ready to get started, but we can't seem to get anybody to agree to sign any documents. And the question came up whether we could get authority to sign these documents. We have the money in hand. We just can't seem to get the attorneys to feel comfortable enough to let the IT be the signer of those documents. As you know, Judge Rogers ruled a little over a week ago now that the IT was a governmental entity and entitled to governmental immunity, and that the IT could be sued. Whether they have any funds, if they get sued for $10 million, well, the IT is a group of jurisdictions that were put together to implement this project, and they don't really stand alone. They don't have insurance of their own. If they get sued for $10 million and there's a judgment entered against them, the question is can they go behind the corporate veil to get to the city, the county, the dam, the hydroelectric group that's in there, the Army Corps of Engineers, and who the whole other composition of the team. Chime in anytime, Chris.
Yeah, as Dave indicated, and I don't want to get into too great detail because we do have pending litigation out there against the county as well as against the IT So we have to be a little careful what we say in the open. Nonetheless, the Michigan Attorney General's office, as well as the Department of Justice on behalf of Department of Interior and other federal agencies that are in this process, their position is the IT doesn't have the ability to sign contracts. Now they did execute contracts in the past. There was a contract executed with AMIC, who was the consultant who did the Brown Bridge Dam removal that's owned by the city. So as Dave has indicated, you know, somebody's going to have to keep moving the ball forward down the field. And really what is being asked of you is to allow Dave Benda the authority to execute the contract with URS, the consultant, to get the next phase of the project moving. Which Bob Cooney and I discussed this issue, and we're both of the opinion that you do have the authority, if you pass a resolution, to allow him to execute the contract. And what we've envisioned and what Dave and I have talked about is the IT will still be involved, but the IT will really serve in more of an advisory capacity. That they will make recommendations, and then Dave will take those recommendations and execute the appropriate contracts. So that's where things stand right now, and that's what we're asking you to do.
And we would not sign any contract, I would not sign any contract that was not approved the same manner that the IT would approve a contract, which is everyone there has to be no objection. So it would have to be a unanimous approval by the IT that I should sign the contract. And there has to be the money in place at the CRA in order to pay the entire bill for the contract. So what you're really doing is you're authorizing me to take on the legal liability of being the one that signed the contract for this phase of the project. The question is when we get to the construction phase, will I be the one that has to sign it then, or will we have the legal issues sorted out by then? I don't have the answer to that. What kind of liability are you taking on? Well, tomorrow we're going to meet and discuss tendering the lawsuit on the Brown Bridge from the IT to AMIC, to have the IT members tender the lawsuit to AMIC because there's a contract out there with AMIC that the IT signed. And remember, they're a governmental entity, and they can sign. And they did sign. But AMIC, in that contract, indemnified the county, the city, and the IT. And what they're saying is, indemnify us, defend us, take this lawsuit. And we would be doing the same thing in this phase with a contract with URS if it's approved by the IT. And we know the funding is in place right now. So it's not, where's the liability? It's going to be like the liability that's been going on all along. It's going to be, you've got governmental immunity for your decisions, and you can be sued, but, okay.
Madam Chairman, in that the Boardman Dam and the Sabin Dam are Grand Traverse County properties, and I believe that these contracts are important in order to move forward with the improvement to those properties, I would move to authorize the County Administrator, David Benda, to sign contract on behalf of the County Board of Commissioners to move forward with the improvements as identified in this plan.
Supported by Commissioner Thomas. Commissioner Inman, you had your hand raised?
I got my question answered by the motion.
All right. Commissioner Lemkool.
I know that this property belongs to us, and and I'm just a little bit concerned some of the past history on some of these contracts, that when an organization throws the responsibility into one individual without the report back to the commissioners to know exactly what's going on before those things are signed. But I don't want us to get in the way of getting those signed either. And I'm just struggling this a little bit because we have this responsibility as commissioners, that we are responsible for this dam, and the previous commission did support the removal of those dams. My other question is whether or not CRA they're the ones that are kind of the developer. Why can't they sign the contract? Or they don't have that liability protection, and so that's why they can't sign them? So I'm just really struggling with this process. to be able to hand off this stuff from our responsibility into your responsibility.
Well, Amy,
He's our designated purchasing agent.
Yeah?
Dave?
Amy Byer contacted me. How this kind of evolved was, she kind of outlined to me that if we don't get moving soon, we're going to miss the funding cycle for the grant funding cycle for federal grants and for, all those particular grants that are out there. And the engineering won't get done in time for us to get the bridge started, to get the grant from the state of Michigan that's been pledged, and that'll go to Saginaw or somewhere else. And she said, so if we don't get moving this month, we're done. I mean, we're putting the whole project back a year, and we're losing funding, and we're gonna have to start, So she suggested there's 3 ways we can go. We can, hope that the IT signs this and comes to comes to some kind of agreement with all these attorneys in a really tight time frame, which doesn't appear likely. Or somebody's going to have to sign the contracts and get us moving, or we're stopped. So those are your choices, and, the easiest one, the one that actually moves us forward, is the one where somebody signs.
Commissioner Rennie?
Weren't we already out of compliance timing-wise with respect to some of this removal? Are we jeopardizing this further also then, or? I mean, some of this was supposed to start in 12, if you remember?
Well, we're out, we should have had the dam out
Well, that's my point.
at the end of 2012.
Is there still jeopardy with respect to that date?
That is a problem, too, for us.
Is that another reason to get on it sooner, you think?
Yeah, it is.
I think so.
I really think that it doesn't matter who signs. I think we're going to go through the same process, no matter who signs, and ultimately, it's our dam, and we're going to be standing back behind the IT somewhere anyway.
I think it's just important that you keep us in the loop as you're doing it.
Certainly
And then-
will. We've got a contract that Chris has signed, and Carrie Seitz has been working with us on the URS contract vis-à-vis the road commission and building the bridge and and designing the bridge. And we're going to the IT tomorrow, or I'm sorry, Friday, and we're going to have some discussions there as well. And the question is can we get the contract signed and get URS working on the project?
Commissioner Wheelock, then Commissioner Inman?
Yeah, to me, this is simple. Mr. Benda is our designated purchasing agent. I'm certainly sure that he's going to report back to us promptly, with any contracts, and we will see drafts of those contracts also, I'm sure. But the fact is, we need to keep this project moving forward. As we all know, we are 5 years behind where we should have been already. And we need to keep this moving, and that's, if having him, this board designate tonight that he is the approved signer, this helps us to move forward quicker. I'm all in favor of that.
Commissioner Inman?
Question for Chris and Dave. Does it make sense to ask the board for immediate ratification and just get this thing rolling instead of waiting 30 more days at
Yes.
the end of the month?
Yeah.
And let's just
Yeah,
get this thing
absolutely.
going. So, Madam Chairman, if we can get the motion maker and everything.
Yes, for immediate ratification, please.
And the supporter, all right?
Yep.
Any further discussion? All right, Commissioner
Real
Rennie?
quick, for Chris. So somehow the IT team now is taken out of line and put someplace else with respect Advisory. to the county now? Is that what you're saying?
If necessary, the IT, if they'll sign the agreement with URS,
Okay.
I won't need to sign.
So you have.
But if they
timing-
are still legally wrangling about, and the members of the IT, a lot of them work, they have to respond to and
Right.
take the direction of the attorneys for the Attorney General's office and the Department of Justice, and if they're being advised not to do they can hold us up for quite some time until they feel comfortable that it's okay to do something. I personally have spoken with Carrie and with Chris, and we had this discussion about where we stand in all this. I think the judge's ruling is perfect. It allows us to continue to do things exactly the way we did them before. It gives the IT the governmental immunity that it really had a question about before. So, if, I won't sign if I don't have to.
Yeah,
If I can get the IT to keep doing it the way they've been doing it, I think that's the best way to do it. But
Well, how long would you like to give them, I guess is what I'm asking.
that's just it. That's why we
Friday.
were asking for this tonight.
Friday today?
The meeting on Friday?
We really want to get it going that
As things
fast.
stand right now.
As fast as we can get that contract language.
The attorneys for the federal government and the Michigan Attorney General's office, they both have said the IT shouldn't be signing contracts. And the way the IT is set up, you have to have consensus. And consensus means everybody agrees, or at least some people don't object. Well, we have two parties, maybe three parties that are objecting right now. So that just grinds everything to a halt. So we got to get this on track.
All right, Sarah, if you would do a roll call vote, please.
Thomas?
Yep.
Wheelock?
Yes, ma'am.
Lemkool?
Yes.
Lathrop?
Yes.
Rennie?
Yes.
Inman?
Yes.
Max Bauer?
Yes. Motion passes. Unfinished business, I'm going to date myself. Under Sheriff Alger, if you would enter and sign in, please. We all remember that show, don't we?
Yeah.
I'm too young.
I don't know what show.
That's a safe bet.
Under Sheriff Alger, Grand Traverse Sheriff's Office.
The subject is fleet vehicle maintenance contract.
As you are aware, we were here, I believe, in June, the first Wednesday in June, requesting approval for a vehicle maintenance contract. There were some questions about the bid process itself, so this board requested we go back out for bids. We did that. Bids were due July 29th. We had 3 service providers bid. I've listed those in your packets, and 1 oil change, express oil change vendor. The requests or the bid results have been listed in order of the hourly rate and the lowest bid, so to speak, and from there on. So the lowest bid was D&W Auto again at $34 an hour with 10% above parts and $19 for an oil change. TC Fleet Repair came in second, $35 an hour, 10% above parts, and $20 for an oil change. And Paul's Auto and RV was $60 an hour with an escalating or de-escalating scale of percentages for parts. So the sheriff, the captains, and I have talked about this for quite some time, specific to which vendor we would like to propose to this board. I would like to note that we have been with D&W Auto for a long time and have had a fairly good relationship with them. We've had minor issues, as you would expect in any service provider, but those issues have always been handled appropriately between Mr. Moody and the sheriff's office. The sheriff's office does want to try a new vendor. They want to see what else is out there in terms of service providing, and we are requesting permission to go to TC Fleet Repair, who is not the lowest bidder, for that purpose, with the one interest in making this a year contract with an optional 2-year contract renewal at the conclusion of the first year.
All right. Commissioner Lemkool?
I'll make a motion to approve the 1-year contract with TC Fleet Repair for 1 year, and then the option for a 2-year contract afterwards.
Support.
Moved by Commissioner Lemkool, supported by Commissioner Wheelock. Discussion. Commissioner Wheelock.
I guess a couple things about, I certainly appreciate the format that we came back to this time compared to what we've seen a couple months ago as far as the information we had available. A couple notes that I noticed. One, TC Fleet Repair designated a specific cost for an add-on for parts, which was a significantly higher number, if my memory is right, in June. So that's important to me. The second thing is we need to note that TC Auto Repair is within the city, and contrary to, despite the fact that we've had a contract with D&W for a long time, as part of that discussion in June, we discovered that we had a number of county vehicles that weren't going there anyway, which was a violation of our own contract. So I am pleased that we're going to try this and have it in an internal, a centrally located location, and see if we can make it work. But I have no problem with approval of the contract.
All right. Any other questions or comments? All right. All those in favor say aye. Aye. Opposed? Motion carries.
Thank you very much.
Thank you.
Next on our agenda.
The only question I had is, I didn't see a date when you're going to start this contract?
As soon as this is ratified at the end of the month, I would assume that is the date, would be the first of the month.
Okay.
unless you can
Makes sense.
go back and make it
Do you
current.
want to do it as immediate?
I think
It's
this
already
is fine.
expired.
We've been kicking this thing down the road for a while. We can have it go till the 1st of October, or 1st of November.
Okay. All right.
All right.
Thank you very much.
Thank you.
Next on the agenda, new business, Commission on Aging Senior Companions Grant. On your desks is a little description, a short description of the Commission on Aging Board's action that was taken this last Tuesday at their October board meeting. We have been a consistent supporter of the Senior Companion Program through Catholic Human Services. And the Finance Committee, the Executive Committee, and the Board as a whole determined that we could indeed make a grant in 2013. So if I could, I would entertain a motion to, and I would appreciate it if this was for immediate approval. I would entertain a motion to award a $10,000 grant to the Senior Companion Program.
Madam Chairman, I'll make a motion, the Commission on Aging request for immediate approval to award a grant in the amount of $10,000 to the Catholic Human Services Companion Program for 2013, with funds to be taken from the Commission on Aging In-Home Services Fund balance with the immediate approval of the Board of Commissioners.
Is there support? Dr. Lathrop. Further discussion? Commissioner Wheelock.
I'm slightly confused. I'm trying to figure out exactly what we get for this $10,000. You know, if I read this, I see that we're going to reimburse these senior companions $2.65 an hour, $2 for a meal, and 35 cents a mile for mileage. I'm assuming that's to and from the senior's residence, or when they're taking the senior, or, you know, I guess my confusion is that I believe that the Commission on Aging has accumulated money, taxpayer money, for the purpose of providing services. And I'm just trying to figure out if this is actually a service that's benefiting, this expenditure of this money is going to actually improve the services provided to the seniors in our community.
Georgia, would you come up, please? If you would be so kind as to give a brief description of the Senior Companion Program for us.
George Durga, Director, Grand Traverse County Commission on Aging. Senior Companion is a program that benefits volunteers, and it benefits seniors that live alone. So the Senior Companion Program matches up a low-income volunteer who they pay the meal stipend and pay stipend and travel pay to go and either be with this client or take this client out shopping or take them to the store, whatever they need to do, and take them back to their home. They spend, I'm thinking around 4 hours, maybe more, with the person that would be alone otherwise. So the funding will go to help 30 seniors and 10 volunteers, so really 40 different people will benefit from the $10,000. And I'm guessing that they've been providing some of this service already in anticipation of getting this funding, because they approached us earlier in the year and our board wanted to wait until November to see if we were going to have the funds available.
All right, any additional questions or discussion? Roll call, please.
Wheelock.
No.
Lemkool.
Yes.
Lathrop.
Yes.
Rennie.
Yes.
Inman.
Yes.
Thomas.
No.
Max Bauer.
Yes, motion carries. Next on the agenda. Thank you, Georgia. The budget process. Dr. Lathrop.
Okay. I was informed that Leelanau County, their administrator and some of their board members was on the on the radio and discussed their great success of their budget process over the last 4 years. It would include things like they're self-insured, they have no structural deficit, they're 83% vested in their retirement program. They put $1 million against the retirement bill, their unfunded liability 2 years ago, $500,000 a year ago, and they're going to put another $500,000 on it this year. They tend to be 100% funded the next 3 to 5 years. The process they use, they started in June. I talked for an hour with Karen Zermitis, who is a board member.
At Beta.
Well, not just Beta, but she's a board member
At Leelanau County.
At Leelanau County. And I was very impressed. Their board started meeting in June, and they met 2 times every month thereafter for anywhere between 3 and 5 hours a time. And they had they looked at every line item of every department. And she said it was a painful, hard process, but they really came out ahead. Let's see. So they had as many as 6 meetings to work out their budget and to try not to kick the can down the road, but to come up with a 3-year budget so they could avoid these financial problems in the future. I admire that budget process, and I'd like to make a motion that we form an ad hoc committee to compare and contrast what they've done with what we're doing, and then report back to this board about that. I think, I'm not saying that we'd change anything, but it'd be nice just to see what they've done, what they've learned, and I think we could learn something from them.
Is there support? Commissioner Lemko?
I don't disagree with you, but I think we're too far down the line this year. But I think for next year, in the beginning of the year, we might want to look at something like that.
Commissioner
But I
Lemko?
don't want to support it.
For the purpose of discussion, I'll support the motion.
Oh.
Okay.
Okay.
All right, I agree with that. I'm not saying that we have to apply it to this year, but
Okay.
but why can't we start now?
Oh, well,
Commissioner Inman?
Well, we've been placed in an unusual position this year, as a lot of you know, and it's been a compounded factor between bringing in a new county administrator and waiting to start the strategic planning process, and then looking at the budget, and then having Dave try to figure out what he would like to come in for a recommendation with, because, you know, he's very skilled in this budgetary area, and we've relied on his ability at this point in time to help lead us through the unknown processes of health insurance and retirement costs and those other things that we're looking at that Leelanau County doesn't have to worry about or talk about. And Leelanau County has a whole different state of circumstances. They're one of the wealthiest counties in the state. Their board meetings are totally structured differently than Grand Traverse. They meet every week on Wednesday from 9 to 5. So they don't spend
9 to 5?
Yeah, from 9 to 5 every Wednesday, or every Tuesday. And so they have a whole different structure in terms of how they meet in terms of dealing with issues. And part of their agenda might be talking about part of the budget, and then the rest of the day is talking about other issues or other things. And their whole process is totally different over in Leelanau County than what we do. Their financial position is totally different than what we are and what we have going on here in Grand Traverse County. So my concern is we would be comparing apples to oranges at some point in time. But my main point is that at least through the end of this year, we know that we have been unable to, as you have suggested, to meet periodically on a regular basis and talk about all the various components of the budget when we don't have that information yet to help us make determinations of how we want to work on the budget. It just isn't going to happen with Obamacare and some of the other issues that we're looking at. We can't make those kinds of discussions and issues right now. So, I mean, some of it we can, but some of it we can't. The big impact dollars, you know, we're still working on. So, I don't have a problem in looking at, with Dave's help and Dave's suggestion, that as we go forward with the next budgeting year in 2014, that we get back to perhaps the previous structure, or we can take a look at other counties, not necessarily Leelanau County. We could look at Leelanau County, but we look at other counties, because he has the ability to, through his county administrators meetings in Lansing and at the MAC conference, to talk with other administrators about how they do budgets and what processes do the other counties in the state use,
that, we started our budget process with Aloya for 10 years in June, with department reports coming into us and then discussion about, what the priorities are for the county. We went through that, and then we had all the departments come in and talk about their individual budgets by line item if necessary. And then, we had 5, 6, 7 meetings regarding the budget that went, for example, 3 to 4 hours each. So we kind of did the same thing that Leelanau does. We've been doing for the last 10 years, except for when we got Dave in, we decided to hold off on those. So I don't have a problem doing analysis and with Dave's help and recommendation of what other counties are doing for their budget process and when do they start and what process do they use. But I don't want to just use Leelanau County as an example. I want to have Dave look at other counties in the state and come up with, who's doing the best job and what the best process is, rather than just relying on one county. And then I would just let him work on that and bring back a recommendation of how we might want to deal with the 014 budget, the 015 budget next year.
Commissioner Rennie.
I guess my question, I think Dan's kind of touching on this, Commissioner Lathrop, excuse me, is what is supposed to be the relationship between this board and the administrator during this budget process? I mean, as far as I'm concerned, we've been kind of left out of the whole thing. I know it's special circumstances and so forth this year, but still, nonetheless, I don't see what our involvement really here is. I don't know how the administrator feels about that.
Well, normally at this time, you'd have a recommended budget in your hands, and you would begin deciding what you were going to do about the recommendation, whether you liked it or not, whether there were portions of it that people objected to. Normally, it's an exception-based process. The processes that you've outlined are much easier for me. If we start the budget in May or June, and the commissioners make all the decisions about what's going to go into the budget, and they meet 5 times or 7 times or however many times for many hours, and they interview all the departments, that's great, because I don't have a lot of work to do in that process. I allow you, or you allow me to sit back and let you do all the work, and I'll be happy to do that. However, that's you managing the budget process. If you want to manage the budget process, you're the board. You do it.
Well,
and that's what you should do. That's what you want to do. However, the process that I've been doing since I started in this business about 30 years ago, I was in a big county, not a small county, not really a micromanaging board, 20 members. Controller, you look at the state statute and you say, the chief operating officer, the chief administrative officer recommends a budget to the board, and the board disposes of it, does what it wants to do with it. It gives you a budget message that says, here's what's changing, here's what it is, you've had your processes in place and you put these programs in place for the last 150 years, and here we are today, and I'm changing one thing or another, or 6 things, or 10 things, or the finances are such that it allows you to look at the differences between what you've got now, where you're going to get, and you can influence how you change it from that point forward. But the problem this year is that we didn't have a whole bunch of very important information to base our budget on. You should, by mid-September, the recommendation comes out. This year, it was impossible to get that information out, and we're going to go into closed session later to talk about negotiations, and we're going to talk a little bit more about. It's still not there. We met with our health insurance agents, and they didn't provide us with the bids. They didn't provide us with just about anything, and that's a problem for us. So we're gonna anyway. The next step in this process, where you fit into this process, is we have to make a recommended budget to you by the middle of this coming month, or this month, and you're going to see where the differences are. It's not a good year. We've arrived at the place where the can was kicked.
Yeah.
Yep.
Seriously, we have arrived at that place. And the capital is, you strike out all the capital, and you strike out all the 6-year-old computers that we're not going to replace, and you strike out all those things, we still got a long way to go. So, we're struggling with trying to balance this budget. Ian and I are spending long hours trying to figure out how to get this number balanced. without too much bloodshed. And, but as far as the process goes and the commissioner's role in the process, you really got to get us deep into these details. This document that's that thick, that has numbers all over it, to get it as tight as we can get it, and then tell you what the differences are from last year. And we've already met with all the department heads and talked to them about they want to do this and they want to do that and they want to change this and change that. We're going to itemize all that for you, put it on in a nice letter for you so you can figure out what's different, and then you take the budget from there. But it's unmanageable. $37 million general fund and $155 million all funds, unmanageable for commissioners unless they want to do all the work. You have to start early and have a lot of meetings.
Dave, first of all, I want to say how much I appreciate all the hours that you and Dean are putting into this, and I know they're long, and I know that you're not getting the information that you need when you need it. But I'm not hearing in Dr. Lathrop's motion any kind of criticism as to how you are doing it. What I'm hearing him say, and he can correct me if I'm wrong, is that let's take a look, or he's suggesting an ad hoc committee to take a look at how other municipalities approach their budget process, how much responsibility they take, what different avenues they take to get information, et cetera, et cetera. I don't hear him being critical in how you're doing it based upon the lack of information that you've got.
No,
I was responding to Commissioner Rennie.
The truth is that I'm trying to get educated, and I've been
asking.
I was hoping you'd help me with that, and you're too busy for that. I was trained in medical school. One of the ways that you learn is you compare and contrast, and we did that with Beta, and we learned some things. And I guess when I look at how good Leelanau has done, they must be doing something right, or something we can learn from them. That's all I meant.
I was responding to Commissioner Rennie's role. What's the commissioner's role? Well, it's whatever they want it to be, but the way I've run it, my budget processes for the last 30 years have been the administrator recommends the budget as according to state statute. It's his statutory responsibility, and then the board disposes of that, changes it any way the board wants to do after that.
I guess my problem with it is we are at a point in the road where we kicked the can apparently long enough. We're going to have to look at it. We may have to do some prioritization. How much time are we going to have to look at this after you bring this to us before it has to be implemented? We're getting compressed ourselves.
Yes, you are. I agree. But you've still got until, the beginning of the year. I mean, you can do a continuing resolution yourself.
Okay, that can happen then.
Yeah.
Okay.
Yeah.
Commissioner Wheelock, then Commissioner Inman.
Well, between the township and the county, I've been doing this 34 years with public taxpayer dollars drawing budgets. And I've seen it go all different ways. I've seen township supervisors and county administrators that 100% handle the budget, and they tell you this is it. I've been to township board meetings where the budget comes out on a sheet of notebook paper, and if they didn't like the number, they scratched out the number and they changed the number. This is truly the first year that we're going to truly see Dave's process of how it comes out for the budget.
Right.
Last year, we just simply didn't have the time or the experience with him to do that. I'd like to see through the process this year, and then evaluate whether or not the process is acceptable to us. I've done the budget process where you go line item by line item through the sheriff's budget and talk about what the Marine Division costs and how much the road patrol costs and how much the court system costs in each individual portion of each line item. But that takes hundreds of hours if you're going to evaluate it and really do it properly. At least hundreds of hours. And I'm not sure that is our intent or our purpose. I think our purpose is to make sure that we're providing guidance and overseeing the budget. I'm not sure it's our responsibility to actually produce the budget.
Again, I didn't hear him say that we're going to produce a budget. I heard him say he wants to look at other processes.
I think we have to finish the 2014 budget and the current process, and then we'll have plenty of opportunity between now and the start of the 2015 budget. to evaluate if we want to do something different.
Okay, Commissioner Inman.
Well, if we're going to come, I agree with Commissioner Wheelock that, we ought to go through this process, try to do our best job in making the decisions by the end of the year. If we have to continue to recess the budgetary hearings and get it done by the end of the year, if that's lawful. And if the board wants to take a look at how other counties in the state are doing the budget process, I think that would be valuable information. But I understand the format that Dave has been used to, and we rely heavily on him to do in terms of recommending, a budget to us. But I guess I'm not in favor of the current motion on the floor, is to create a board ad hoc committee to review this now. And even when we even if at some point in time where we want to consider taking a look at what other counties may be looking at for a process for their budget, I just assume, because Dave knows all the administrators in the state, for the most part, I don't want to have us calling other county administrators or other commissioners all over the state as a ad hoc committee, meeting for months, trying to extract that, when Dave can just go down to his administrator meeting and find out what all the counties are doing and how they're doing it, and bring back a report to us. I mean, I don't see that the ad hoc committee is necessary. If we're looking for what other counties are doing in the state of Michigan for a budget process, he just needs to go down and meet with his administrators and come back with a report. We don't need to form an ad hoc committee.
Commissioner Lemko.
Yeah, I can't support the motion at this point either, but, my only concern about this whole process is how much work we're going to put on Dave. And we piled a lot of work on him. And between him and Dean and the rest of his organization, with this dam thing, that's unusual for most. And so he's right in the middle of all that. Plus, he's in the middle of all this budget. And right now, I'm not sure we could put another thing on his desk and he'd get it done. And so I would just as soon wait until after we get done with this budget process, keep this in mind, so when we start doing our plan for next year, that we can maybe look at some of these things and going to the MAC conference yourselves and asking those questions. How do you do those? And working that kind of relationship so you figure out where these things are, what should be done. And I think that's the way we want to work at it.
When you make a motion, it's, Robert's Rules of Order says it's just, well, you do that is to engender a discussion. But I'm really happy with the discussion we're having tonight, so.
All right. Roll call, please.
Lemko?
No.
Lathrop?
No.
Rennie?
No.
Inman?
No.
Thomas? No. Wheelock?
No, ma'am.
Max Bauer?
Yes.
I was going to ask if he wanted to withdraw his motion, but
No, this is more fun.
All right. We are done with new business. Moving on to second public comment. Matthew.
Hey, you've got shorts on still. Must be warm outside.
I know, I'm kind of force the weather here. Thanks to my good friend
Matthew,
Karen sitting behind. Matthew Scheck, 306 West 9th Street, Traverse City, Michigan. Thanks to my good friend Karen, who knows of my family particulars, that one of the members of my family received an organ donation 3 years ago, September 13th. And what a blessing that was to get an organ donation. Saved my wife's life. Wow. And the person who gave it happened to be our middle child. Actually, he's the one that should be here praising organ donation. But my wife had been a diabetic since her third pregnancy, so she was in end-stage renal failure for 3.5 years. It got to the point where she was just giving up. She was just so tired of it. And God bless those people at the dialysis center. They are really great and wonderful people. But she was really getting tired of going through the dialysis thing. Her body was just wearing out. And the kids could see that, and they did on their own. They did some medical testing. St. Mary's Hospital in Grand Rapids was the hospital where the transplant took place. But it was our middle child, Adam, who said, yeah, Mom, I'm going to do something. And his blood type and other things turned out to be a good match. She had an organ transplant, again, 3 years ago. And we like to say in the family that's the second time in her life that she's had that kidney inside her body. And those of us that know the middle child know too that kidney has had a good workout on good American beer. So that should really function very well for her. And I'll tell you, organ donation in our country probably isn't emphasized enough. Okay, it seems like it goes in periods, but it really is a lifesaver. There's so many different things that I found out on my own is that there's a lot of different donation organizations out there. My wife was on so many lists that we put her on, but a lot of people don't make it, especially those people with end-stage renal failure. Sometimes they just get tired, like my wife was doing. She just wanted to give up. She got to the point where it's just hard on them. But I even was going through the process of joining like a chain donation where you donate a kidney to some stranger, and that spouse of that stranger goes out and they donate it, and then somebody else, and so you match, but it has to be done so you're matching all different blood types and all the different characteristics. But it's really a difficult thing today to get the donation, and a lot of times it probably is through cadaver, or you could just run into those wonderful angels that want to help out and give an organ and save someone else's life. So I just wanted to reference that and get Karen off my back. Thank you.
Matt,
I've got the little insignia on my driver's license, so.
Matt, what's your son's name?
Adam.
Adam. Okay. And how old was he when he made this?
He is 41.
When he made the donation?
Pardon me?
How old was he when he made the donation?
3 years ago. 38. So he was 37. He came through it okay. It's a little hard. I shouldn't say this. It's a little hard on males donating, just that it is. But he came through okay. And both of two of our three children work in a medical field, so he was a little bit familiar that he was going to be going through it, but he decided he was going to do it, and he did, and he's been doing pretty good.
That's a great story.
So yeah,
it is.
Thanks for sharing that.
Hopefully, it encourages others.
Thanks for
Mr.
sharing.
Thomas?
I would just mention that a friend of mine that used to own a store up on East 8th Street, he went through about 9 or 10 years of dialysis 3 times a week.
Yeah.
He finally got a new kidney, and within 2 years, he died from something else.
Yeah.
Good grief.
There is no guarantee. But
Well, he was so,
sometimes it works out.
well, he was so weak
Dicky.
Yeah.
that he couldn't fight anything off.
Yeah. Well, my wife has known a lot of people through the dialysis center process. And the saddest stories are those people that just give up after a while. It's just hard on them.
That was part of it.
If you go through a couple of years, it's okay, but my wife was over 3 years, and they could never just seem to get off enough. Her body was just wearing out inside. But she made it, so we're praising God. Thank you.
Yeah, great, Matt.
All right. Commissioner committee reports. Commissioner Lemkool?
Yeah, just a brief update as to what's happened with 211. United Way has held the contract with Muskegon for 211 for the last year, and they've elected not to renew that contract. We find out that the cost of that is too prohibitive to continue it. It's about $4,000 a month, $48,000 a year, for about 68 phone calls that we know of at this point per month. And plus it's per call basis, and so they elected not to renew the contract at the end of September. We're not sure where it's going to go. We're not sure if Muskegon still answers the call as 211 as to what's going to happen there. So I just wanted to let you know if you hear of anything that we're working on it, but we're not sure where it's going to go. Rotary gave a grant a year ago for $40,000 to keep this going, and they were going to give another grant for $25,000 for this year. But United Way is already in the hole for $15,000 for the last year, and so therefore that's not going to go forward with that. We're still meeting to try and figure out where we're going to go, but we also understand that there are other communities that are not going to renew their contract with the Muskegon Call Center also. So it's going to be an interesting work in progress, so you know what's going on.
All right. Anyone else?
So.
Commissioner Rennie? Yes, went to a wonderful memorial Saturday for John Burgess, service guy welcomed home by two nations. It was very touching.
So, and I noticed we got a couple of thank you cards on your desk with the
From the health
accreditation.
department. Yeah.
You know, it's nice of the health department to recognize each of us, but it's not us that's doing the work, it's them. You know, without the staff that they have and without the leadership that they've got, we wouldn't have the quality health department that we've got. And I just want to say, we should be saying thank you to them for making us look so good.
Anyone else with a committee report? Notices and announcements? Seeing none. We do have a closed session. I would entertain a motion to
Madam
go into
Chairman,
closed session.
I'll make a motion to go in closed session to discuss labor negotiations.
Is there support?
Yeah.
Moved by Commissioner Inman, supported by Commissioner Thomas to go into closed session.
Do we expect to make a decision that we will need to vote on when we come out?
No.
Roll call, Sarah, please.
Lathrop,
Yes.
Rennie,
Yes.
Inman,
Yes.
Thomas,
Yep.
Wheelock,
Yes.
Lemkohl,
Yes.
Max Bauer.
Yes.
I think that went.
What would happen?
We got 5.
We got 5
We
motions.
gotta wait for our clerk. Give her a break. Okay, I would entertain a
Madam
motion to
Chairman,
come
I'll
out
make a
of
motion to
closed
come out of
session.
closed session.
Moved
Support.
by Commissioner Inman. Who supported?
Support.
Commissioner Wheelock. All those in favor to come
Aye.
out of closed session? Aye.
Madam Chairman, I'll make a motion to adjourn the meeting.
I'll second.
All gone.
Moved by Inman, supported by Lathrop. We're out of here.
Thank you, everybody.
Thank you.